And so just remind me, how long has it been since you started the stem cell treatment?
I did my stem cell treatment almost 2.5 years ago now, I think.
Okay. And what difference has it made? Like what can you do now that you wasn't able to do before?
It was really interesting. I I got the stem cell injection, and about 2 weeks later, I was in a training, class, and we were staying at a hotel, and the guy came to pick me up, and I walked down the stairs and got in the car, and I realized right at that moment, I took those stairs 1 foot at a time instead of 1 foot down, then the next foot, 1 foot down, then the next foot. That's the very first time I recognized that there was something significantly different at play, right? I've been able to take a pickleball since then.
Mm.
We're gonna try and go skiing next year. See how that works out. But if there is truly regeneration taking place, and unfortunately, I did not have a pre and post MRI. I kind of wish I had now.
Mm.
But if there is regeneration taking place, I figure 3 year gap between that time, maybe I'll actually be able to ski.
Mm. Interesting. So you're playing pickleball. How regularly can you play?
Oh, I played maybe once a week.
Okay.
Yeah,
And any kind of sensation in the knee, or does it just feel completely normal now?
it feels pretty good. I actually had kind of weird. I had a instance the other day where um, something ticked in it, and it swelled up a little bit and actually hurt all day. And I happened to have a course of oral prednisone, and I took a high dose of prednisone, and within 24 hours it was perfectly fine again. But so there's still some stuff going on in there, and the
And what
osteoarthritis is probably never going to go away. But
Yeah. And what about just kind of general walking? Like I imagine that's a lot easier now.
yeah, yeah, I can jog again.
Right. Okay. And I guess, if your son still wanted to go hiking, you probably could.
Yeah, he's 23 now. I don't think he's going to go.
Dad's not as cool anymore.
No, 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 that's not quite. Unless he needs money in his bank account.
Yeah. So, um, if you were to speak to someone who was kind of thinking about, maybe they were in the situation you was in when you were in, you say, late 20s, let's say,
No.
how would you describe kind of how you were feeling then and how you're feeling now? And what sort of advice would you give to them?
Yeah, so, in my 20s, my knee hurt. At 57, the rest of it hurts. Um, but, yeah, so I think that my advice would be, first and foremost, take care of it. Maybe if you have a knee injury like mine, maybe don't play tennis. Maybe or at the very least, just stick to doubles. My biggest, I tried to be Patrick Rafter. I was a serve and volleyer, and I
Mm,
played singles, and so I was really hard on my knee.
yeah, lots of
Um,
changes direction very
yeah,
quickly.
so I would probably tell them, don't quit sport, but take up sports that are not as going to be as impactful on your biology as something like tennis or something of that nature would be, on your knees.
If this sparked something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify or listen on Apple Podcasts. Like, subscribe, and stay connected for more.